Does intermittent fasting on keto make irregular heartbeat worse? Have you ever wondered how intermittent fasting on a ketogenic diet might affect your heart? This is a topic that many people are curious about, especially if they have experienced irregular heartbeats. Let's break it down. Intermittent fasting combined with a ketogenic diet can indeed influence heart rhythm. For some individuals, this combination may worsen irregular heartbeat or heart palpitations. The main reason for this is how both practices impact electrolyte balance, hydration, and blood volume, all of which are essential for normal heart function. Starting with the ketogenic diet, it often leads to increased water loss and reduced sodium levels. This happens because of lower insulin and carbohydrate intake. When sodium levels drop, it can create an electrolyte imbalance. Low levels of sodium, potassium, and magnesium can lead to heart palpitations or irregular heartbeats. Dehydration and low salt intake are common issues on keto, especially in the early phases of ketosis, when the body excretes more water and electrolytes. Now, when you add intermittent fasting into the mix, the risk of experiencing an irregular heartbeat may increase. Fasting means fewer calories and fluids consumed, which can lower blood sugar levels and reduce blood volume. With less blood volume, the heart has to work harder to pump blood, which can lead to an elevated heart rate or palpitations. If you are active during fasting, your heart rate may rise even more to compensate for the lower blood volume. The combination of a ketogenic diet and intermittent fasting can exacerbate electrolyte imbalances and dehydration. Electrolytes like potassium, sodium, and magnesium are vital for the electrical signals that control heart rhythm. An imbalance can disrupt these signals, increasing the chances of arrhythmias, including atrial fibrillation or other irregular heartbeats. To help manage these risks while following a ketogenic diet and intermittent fasting, there are some simple steps you can take. First, make sure to stay well hydrated by drinking plenty of water throughout the day. Second, ensure you are getting enough electrolytes, particularly sodium, potassium, and magnesium. You can achieve this through your diet or consider supplements if needed. It is also important to monitor for signs of electrolyte imbalance. Symptoms such as dizziness, muscle cramps, or palpitations should not be ignored. If you notice these symptoms, you may want to adjust your fasting and keto practices. This could mean shortening your fasting windows or slightly increasing your carbohydrate intake to help stabilize blood sugar levels. Lastly, if you have a history of heart rhythm issues, it is wise to consult with a health care provider before starting or combining these dietary approaches. In summary, intermittent fasting on a ketogenic diet can make irregular heartbeat worse due to the effects on electrolyte balance, hydration, and blood volume. By carefully managing these factors, you can minimize heart rhythm disturbances while enjoying the benefits of these dietary strategies.